Are you tired of shoulder pain keeping you from pursuing the activities that you really enjoy? Whether it's exercise, sports, or just activities around the house, having a painful shoulder sometimes can be very discouraging and can keep you from doing the things that you really want to do. As an orthopedic surgeon, I see people that struggle with shoulder pain on a daily basis. And one of the most common problems that causes that is a problem involving the rotator cuff. Now, there are a variety of treatments available for dealing with a rotator cuff problem. And in today's video, I want to quickly summarize some of those so that you'll have an idea of kind of what the full spectrum of options are for you. Because while surgery is probably what people hear the most about rotator cuff issues, that's certainly not the only solution, and not everybody with a rotator cuff problem needs surgery. So the two categories of problems that we see affecting the rotator cuff are tendinitis, which is inflammation of the tendon, or a tear, which is damage to the tendon. And the treatment that we recommend for those is very similar initially, but sometimes will require more depending on how severe the problem is. So if there's inflammation in the shoulder, then an anti-inflammatory can be very helpful for that. The most common initial step is going to be just simple over-the-counter anti-inflammatories like Motrin or Advil or Aleve. But if those are not effective, then moving on to prescription anti-inflammatories might be more helpful. Some people just can't take those medications, or they just simply don't work well enough. If the oral medicine isn't working, then generally the next step up from that is going to be a cortisone injection. Now, you probably hear lots of horror stories about cortisone, and we don't want to go overboard with using cortisone, but in the proper setting with the right application, cortisone can be very safe and can be very effective. Generally, the cortisone is administered inside the shoulder at the site of the problem, and it works better and faster than the oral medication. Sometimes an injection will alleviate the problem entirely, and sometimes it requires a series of injections, maybe every few months until the problem ultimately goes away. But it's not something that once you've gotten an injection, you have to keep doing the injections on a regular schedule indefinitely. Usually that's a short-term issue, and it's not something that you have to commit to over a long period of time. The third thing that we recommend is physical therapy. Now, sometimes that can be done as an independent home-based exercise plan, and other times it's better to do that in a more supervised clinic-type setting. So often we'll get questions from patients that are very active, and they wonder, why do I need to go to physical therapy? They go to the gym regularly, they play tennis or basketball or golf, and so they don't really understand the benefit or the value of working with a physical therapist. The issue that we see often in the shoulder is that sometimes the mechanics of the shoulder get off a little bit. And so if it hurts to move one way, then people are very good at subconsciously avoiding that movement, and they compensate and they'll move a little bit differently. So one common one that we see frequently is when you raise your arm out to the side like this, that sometimes will hurt with a rotator cuff problem. And so if this shoulder hurts when I do this, then I'll compensate and I'll raise my arm up this way, and that's not normal movement. So if I stand in front of a mirror and you could see the difference in the way that I'm raising my arms, it looks like my arm's going up the same, but this shoulder is getting much closer to my ear because my motion is abnormal. And if you don't realize that's what you're doing, you may be doing it and not even pay any attention to it. A physical therapist, on the other hand, is trained to notice those sort of things, and they will help you come up with exercises that force you to move your arm in the right way and restore the natural, normal mechanics of how you should move. The second problem that we see with people doing independent exercises is that they don't know when they're ready to move on to the next step or when they need to stay put for a little bit longer. And so without the expertise of someone who's used to watching people go through the progression, then you kind of have to make it up as you go along. And for some people that works, but other times people either go too fast and their problem flares back up again, or they go too slow and they're struggling with a problem for months and months and months when they could have gotten better in a matter of a few weeks with the right program. So oral medicine, cortisone injections, physical therapy, and then the final step sometimes is surgery. And the surgery can consist of one of two things. If there's just inflammation, often that can be caused or at least aggravated by bone spurs that exist in the shoulder. And by eliminating those bone spurs, we can usually get rid of the problem, restore the motion, restore the strength, and eliminate the pain. That is an arthroscopic surgery, so it's just a couple of small incisions, usually one in the front, one in the back, sometimes one on the side. And then with a camera inside the shoulder, we can see everything, clean everything up, and that's not a long, drawn-out recovery. The other more common surgery is actually a repair of the tendon. If the tendon is damaged and it's not connected to the bone anymore, then you can't always get full recovery with non-surgical treatment. And so sometimes surgery is the only way to fix that. And what we do at the time of surgery is actually reattach that tendon back to the bone. Well, the issue that causes is that it takes time for that tendon to heal back to the bone. It's not an instant recovery. And so for a period of weeks after surgery, you have to avoid putting stress on that repair. So that's why you see these people walking around in these slings with a big pillow and they can't use their arm normally because they're protecting this surgical repair while it heals. Now, most people, once they go through all of the physical therapy and get their motion and strength back, are very satisfied with a rotator cuff repair, but it is a longer process than if you were just going in there and cleaning things up or removing bone spurs. So those are the 4 major treatment options available for rotator cuff. Hope that was helpful. If you have any questions about that, if you think that you're struggling with a rotator cuff problem and need some help, contact me at my office. Davis Orthopedics is how you can find me, and I'd be happy to help.